Welcome to Methodist Medical Center. I'm Debbie Simon, the Chief Nursing Officer and Chief Operating Officer. We are pleased that you have chosen Methodist, and I thank you for taking time to watch this video. I will be explaining to you how we will deliver outstanding care. Nothing is more important to us than your safety. That's why the following methods are used to keep you safe while you are here. Your nurse will always scan a computer barcode on your wristband before you receive medication. This allows your nurse to confirm your identity and make sure you're receiving the right dose of the right medicine at the right time. Of course, if you have questions about your medications at any time, we want you to ask. Frequent hand washing is another way we keep you safe. It's the best way to prevent infection. You should expect all nurses, doctors, staff, and visitors to wash their hands with soap and water or clean their hands with this special gel before they enter and leave your room. If necessary, don't hesitate to remind them to do so. Call, don't fall. Please use your call light to ask for help if you feel weak, dizzy, or lightheaded and need to get up. And use the call light in the bathroom to ask for help getting back to bed. Your condition or medications might make you unsteady. So when in doubt, call us for help. You're not bothering us. We care about you and don't want you to fall. At times, throughout the day, you will hear a song playing for a few minutes in the halls. It's a signal to our staff to turn patients who cannot move on their own to keep their skin healthy. We hope you enjoy the music and change your position too when you hear it. Communication is at the heart of everything we do at Methodist. We will communicate often with you about your medications, your treatments, and your test results. And we want you to communicate with us. The names of your nurse and nursing assistant are written on this board. Use your call light anytime you need to reach us. Speak up, ask questions. After all, you are the center of your healthcare team. Have you ever had questions in mind for your doctor or nurse, but when the time came, you forgot what to ask? It happens to all of us. That's why we encourage you to use this pen and notepad to write down your questions and your concerns. If you or your family have concerns about any aspect of your care, please talk with your nurse or patient care facilitator first. If you have unanswered questions, please ask to speak to the nurse manager or the nursing supervisor. Still have concerns about your care? Simply dial 0 to reach the hospital operator and ask to speak to a patient advocate. In the unlikely event that you have a serious concern about your medical condition that is not being addressed by these members of your healthcare team, you may call the Urgent Assessment Team at 122 and request an evaluation. Your comfort is a top priority at Methodist. We will work with you and your doctor to manage any pain that you might experience. We'll ask you on a regular basis to rate your pain on a scale from 0 to 10. 0 means no pain, while 10 represents the worst pain ever. Tell your nurse what level of pain you're feeling so your medication can be adjusted to keep you comfortable. A list of medications you'll be taking home must be double-checked for accuracy. Your nurse will also call all doctors involved in your care, make follow-up appointments, and order home medical equipment as needed. Your nurse will carefully explain what you should do to continue your healing at home. A social worker may also be called in to help with your going home plan. Please be patient. It may take a few hours to make sure you have a safe, smooth transition from hospital to home. On a scale of 1 to 5, we strive to provide you 5-star care and service. If at any time you do not feel you're receiving the highest level of care, please notify us immediately. After you return home, you might receive a patient satisfaction survey in the mail. If you do, please tell us how we did. But please tell us now if there's anything we can do to serve you better. Thank you for taking time to watch this video. When you feel up to it, please take a few minutes to look at our patient handbook. It contains helpful information about our services and a quick phone guide for frequently called numbers. Your nurse will be in shortly to explain specifics about this floor. As always, feel free to ask questions. We'll keep you comfortable, safe, and informed. At Methodist, we're committed to delivering outstanding health care, period.